This is my 15.2 sports injuries screencast. So during the screencast, I'll be looking at the physiological and psychological responses to an injury and applying this knowledge to two real-life examples and how they physically and psychologically dealt with their injury. So firstly, physiological responses. So this is like the body's physical mechanics that will respond to it when an injury takes place. So they are initiated to repair the damaged tissue. So firstly, a strain. So a strain is damage to a muscle or tendons caused by overstretching in a particular area. Similar to a strain can result in a simple overstretching of the muscle, but in more serious cases, a complete rupture. So these are common in sports involving dynamic lunging, and in contrast, sports like tackling football, for example. So the severity of a strain can be categorized into three categories. So grade 1, which is a pull, which is relatively minor, 10 to 15% damage to the muscle fibers, and it's stage 2 is a tear, so the muscle is more damaged but not completely ruptured, but is more extensive damage to the fiber tissues. And grade 3 is a complete rupture, 50% to 100 of the muscle fiber has occurred. So in most cases, this will require rehab and surgery. So a sprain. So a sprain is damage to a ligament, so stretch or tear. It's usually caused by a sudden twist or fall that makes the joint move outside its ordinary range of movement. Sprains commonly occur in places like the ankle, wrist, thumb, knee. The severity of a sprain depends on different factors, like whether one or more ligament has been damaged at the same time. Also, whether the ligament is stretched or torn determines how severe it is. Sprains can be categorized into either first, second, or third degree sprains, depending on the severity. So first degree sprains are stretches of the ligament, so no tear occurs. Second degree sprains are potential tears of the ligament, and third degree sprains are complete tears of the ligament or detachment of the ligament from the bone. So hematomas. So in general, hematomas are pockets of solid blood caused by bleeding to a specific area of the body. They can be small bruises or more serious when they occur to an organ like the brain. The majority of hematomas occur to the muscle caused by an impact or rupture. So they fall into two categories, as you can see on the screen. Firstly, intermuscular hematomas, and this is when the damage to the muscle causes blood flow within the muscle belly. So the bleeding does not seep into surrounding tissue, but is restricted to a specific part of the muscle that is damaged. And intramuscular hematomas, so the bleeding escapes into surrounding tissues and spreads to several bundles of muscle fibers. So with this type of injury, the bruise can spread to areas where the injury didn't occur, and it can look very bad. So next, the blood clotting mechanism. So there are 4 stages to this mechanism, as you can see. So these stages help to control blood and stop bleeding, reducing the amount of blood that is lost. So within the process, there'll be damage done to the blood vessels, which then exposes collagen fibers. So first stage, so stage 1, so the platelets are activated by the exposed collagen, and these platelets form like a plug. Stage 2, the clotting factors help to reinforce the platelets, which means that the plug begins to get stronger as they may become loose. Stage 3, this is when the fibrin molecules polymerize, meaning they will create a web and trap more platelets and act like a glue to help stick everything in place. And stage 4 is the other cells, which, like for example, red and white blood cells, and they help clot a seal that, to help seal the wound and ensure the plug is sealed, and it will help keep it strong and compact. So next to the 3 stages of healing. So the 3 stages of healing, which will have different time periods. Firstly, inflammation. So this is where the blood vessels constrict and seal themselves off as the platelets create substances that form a clot and sort of bleeding. This takes around 3 to 5 days. Next is the repair phase. So this is where the wound begins to form new healthy tissue. For this new tissue to form, there needs to be a sufficient supply of oxygen as well as nutrients. This stage takes around a couple of days to 4 weeks, depending on the severity of the injury. In this stage, the colour of the tissue is an indicator of the wound. For example, if the tissue is dark, then it's a bad sign and can indicate the wound is infected, whereas if it's a pinkish colour, then it's a sign of a healthier tissue. And the final stage is remodeling, and this is where, so this is the last stage of the healing, and it takes around a couple of weeks up to 6 months. This happens when the wound is closed up. So during this phase, the tissues are remolded, and the non-functional fibroblasts are replaced by new ones. So now moving on to the psychological responses. So this is like the mental aspect of how an athlete copes and comes to terms with their injury and treatment. First is the stages of grief. So the first one's denial and isolation. So this is the first stage where a person tries to suppress the shock and horror of the situation by rationalizing it. It's a reaction to learning of a serious injury to prove reality, and it's a defense mechanism that buffers the immediate shock. For example, if a football player had fallen and injured themselves in training a week before an important tournament, they will be telling themselves that it'll be fine and it's not that bad and they can carry on. Next is anger, and anger comes with when denial is faced, and you come to face with the pain and reality of what's happened. So it's not something you can prepare yourself for. It comes around and it's overwhelming and you have intense emotions. So anger may be aimed at an inanimate object, complete stranger or family. So for example, if you get angry and frustrated at a netball game because at the beginning you broke your wrist and you feel like you've let the team down. Next is bargaining. So this is a coping mechanism which we try to regain control of the situation and what's happening. So the normal reaction to feeling of helplessness and vulnerability is often a need to regain the control over negative, questionable thoughts or questions. For example, if an athlete would try anything to play a match, as they would want to be taking like medication, massages, other techniques, like all these things, so they can play. Depression. So this is the worst stage of grief, as an athlete will endure during the grieving process. So a lot of athletes experience depression when they begin to believe their injury will never actually heal and they'll be out for a long time, which will cause them difficulty when playing for the rest of their athletic career. This could isolate them from the rest of their team, which could also lead to depression. So for example, if a rugby player snapped their ACL before the season, they would isolate them from the rest of the team, which could lead to them being depressed because they're not socialising with the team and they feel like they're being left out from everyone else. So the final stage is acceptance. So this could happen at various stages of an injury, either when an athlete starts their rehab or when they're close to being back in the game or performing. So this is the best stage because you know you're close to being able to get back doing what you love as much as you want to do. So therefore, there's no point in being angry and depressed. Athletes should try and get better and think about the rehab and the goal setting for future to get them back playing as soon as possible. So next is the emotional states of mind. So firstly, anxiety. So this can be before the diagnosis and felt by athletes during competitions. So if the athlete gets an injury, then these feelings will increase. Fear. So this can take many forms, including the fear of a reoccurring injury and fear of not returning to full fitness. And it can be at any time of an injury when you are unsure of how severe the injury is. Isolation. So the injured person might feel isolated from their teammates, as many team sports players get frustrated and annoyed that they're not being involved in training and competition with the rest of the team. This could lead to them becoming mentally withdrawn from the rest of the team. Frustration. So this is common for many people, especially with the long-term injuries, as they're craving to return back to training and competition. So they feel like they're frustrated by a lack of physical exercise they're able to do, if it's like a leg injury, for example. They may also be frustrated themselves because they might have known that they didn't warm up properly, and they might have felt a problem, and they know they should have stopped instead of carrying on and actually sustaining that injury. And next is anger. So the injured person can become angry towards themselves, the injury, or external objects. at the time of the injury, particularly towards the person that caused the injury. Also, they might get angry during this time of diagnosis if the injury is worse than they expected and they're going to be out of action for a longer period than they originally thought. Next is denial. So sometimes athletes try to deny the severity of the injury and try to return to sport as quickly after recovery, but they also may deny it at the time of the injury as they want to continue playing and be part of that game that they were doing when they hurt themselves. So it's important that supporting players and coaches and family are aware of the nature of the injury and take guidance from medical professions. Next is lack of motivation. So some injuries can take longer to heal. As the process increases, they may become less motivated towards their sport as they have been away from it for so long. So during the recovery process, if they are not hitting short and medium term goals, then they're going to be less motivated as they feel like they can't do it. A lack of confidence. So as an athlete returns to training and performing, they may be less confident for many reasons, like having reduced fitness levels, skill levels, and the ability to push their body physically, for example. And lastly, depression. So some athletes may demonstrate signs of clinical depression, like constant sadness, decreased energy levels, withdrawal from social contact, as they may sustain these symptoms uh, after a couple of weeks from being inactive and being injured.